right, ladies and gentlemen, welcome to another episode of Women's Health Today with Dr. C. I'm Dr. Leroy Campbell, also known as Dr. C, the Women's Health Doc. And today we're going to be talking about something that's very common for us as gynecologists, and that is vaginal discharge. Very commonly presenting gynecological problem. So in this video, I'm going to hope to achieve a few things. The first thing I want to do is to properly define this, to understand what it is that we are talking about when we talk about a vaginal discharge. It seems simple enough, but just to make sure that we're clear, I'm going to define it. Then we're going to talk about why it's important, but also identify what are some of the features that differentiates what's normal from what's abnormal, and what are the potential causes, and what clues can we have as to what may be the cause of a particular vaginal discharge versus another. Okay, hopefully this is going to be beneficial for you. For those of you who are new to the channel, then you will know that my entire focus here is on empowering women through the provision of quality health education. And we understand that if women are educated and empowered, then it's going to contribute to an enhanced quality and hopefully quantity as well of life. So, of course, if it is that you are also one of those persons who thinks this is an important initiative, ensure that you smash the like button, that you subscribe, and you share this video. Okay. All right, so let's get into it. Let's do this. All right, so vaginal discharges. Now, when we're talking about a vaginal discharge, it's essentially where a woman feels that is aware of an increase usually an increase in wetness from the vagina, or increased flow from the vagina that is separate from the menstrual flow, of course, separate from her period. It's very important for us to understand that most women will normally have a vaginal discharge. So there's what we call a physiological vaginal discharge, meaning that there is fluid that comes from the vagina. And it's important for us, firstly, to differentiate between what's physiological and what's pathological. And pathological is really speaking to a discharge that is due to some underlying disease process. And I'm going to differentiate those as we go along. So why is it important, though, for us to have this discussion? Why is it important for us to understand this issue of a vaginal discharge? It's pretty straightforward why this is important. The first thing is that if there is something that is affecting a woman's comfort and self-confidence as it relates to her own body, especially in the context of sexual intimacy or general hygiene concerns, then it's going to affect the quality of her life. And so it's very important that from that standpoint, the quality of life perspective, that this is addressed. Also, vaginal discharge is really a symptom that could be as a result of a myriad of conditions, some of which can be quite serious. So, for example, sexually transmitted infections, even cancers can present with an abnormal vaginal discharge. So it's very important for us to be able to separate and identify where these problems are. So vaginal discharge is actually quite a common disorder, and based on the WHO statistics, it suggests that there is a prevalence of just under 10%, so about 7%, which means that pretty much at any given time, 1 in 10 women will be experiencing some kind of issue as it relates to an abnormal vaginal discharge. So if you think about it, that's pretty common, and therefore certainly something for us to pay attention to. Okay, so let's get into it now. Let's get into some of the possible reasons why a woman may be having a vaginal discharge. So as I said to you at the beginning of the video, it's key to understand that all women have a vaginal discharge. There's a question of how much really, especially women who are premenopausal, who have normal estrogen levels, then as a natural process, physiological process, there is a vaginal discharge, right? So we have to separate between what we call a physiological vaginal discharge, meaning the normal discharge that is expected from the vagina, and a pathological vaginal discharge, which is a discharge that is caused by some underlying disease process. Okay. So let's start first of all with physiological, because if you understand normal, then it's easier for you to say, okay, something is wrong. It's easy to find the abnormal. Make sense? Yeah, it does, right? So let's talk a little bit about normal. So the normal vaginal discharge is really, as I said, in women who have normal estrogen levels, is due to a combination of factors. One is the shedding of the cells that line the vagina, right? That line the vagina. So those are what we call desquamated cells, and that's mixed in with mucus that is being produced by the cervix, which is also mixed in with fluid, essentially water, that is coming through from the blood vessels underneath the lining of the vagina, and it's giving that's what gives rise to the normal vaginal discharge. And this process is very important and is part of the way the body cleanses itself. So there's that flow of discharge downwards that cleanses the vagina, and the acidity within this is maintained. The pH is maintained in an acid pH, which is deleterious to bacteria that would otherwise cause disease. So the normal physiological vaginal discharge is very, very important to the maintenance of health because it cleanses the vagina. And under certain circumstances, it goes through changes. But the key thing here, and the key thing that I want you to understand, is the characteristics of the normal physiological vaginal discharge. And we're going to look at it in terms of color, in terms of consistency, in terms of the odor or smell, and also as it relates to other associated symptoms. Anytime we're evaluating a discharge, there are four key components that we want to know about. One is, the color of it. What's the thickness like, the consistency like? Does it have an odor? And then, of course, are there associated symptoms? All right. So if we talk about the color or the appearance, then generally the normal physiological discharge is either colorless or it appears white, typically colorless or white. In terms of consistency, it's usually thin, although it varies in terms of thickness, but certainly it is never clumpy and very thick. Okay. It's usually thin. So we're saying white or colorless, typically thin in terms of consistency. And then thirdly, it either does not have an odor. Well, certainly it does not have a bad odor. So it's not malodorous, right? And then there are no associated symptoms like burning, itching, or any discomfort. And usually once those four boxes are checked, then we can feel pretty confident that we're dealing with a normal vaginal discharge. Of course, if you're seeing the physician, then generally, apart from just asking the questions, we would take a look using a speculum just to see for ourselves what's happening and to make sure that everything is normal. Okay, so a few key things to know about the physiological or normal vaginal discharge. One, I mentioned the characteristics, but also that there may be slight variations in terms of the quantity and the character of the discharge depending on a woman's situation where she is in her cycle. Also, if a woman is pregnant, for example, the vaginal discharge actually increases. And that's because of the increased hormonal secretion, increased blood flow to the vagina. So there is increase of the liquid component as well as the cellular component of the discharge. And so the quantity of the discharge is increased. And the reason it's important for me to clarify these points or to make these points is because sometimes whenever there's a change, it causes concern, right? So woman is noticing that there's a change in the character of her discharge, and now she's wondering if there's a problem. And I've seen patients. I remember one particular patient who came to me very frustrated because she was going from doctor to doctor, getting treatments and medications, and where she was also using her own remedies over the counter, trying to treat this vaginal discharge that she had, and was not getting better. And nothing would treat it. And in fact, So when I saw her and asked her the questions, discharge, of course, was thin, white discharge, no odor, no associated symptoms. And when we examined her, the features were consistent with that. There's no evidence of any other issue. And the reality of it, the reason she was not going away was because there was nothing really wrong. So she was treating something that really didn't need treatment. And, when I speak to other colleagues, this is a fairly common experience. So it's very important for women to understand that there is a normal vaginal discharge and to be aware of what those features are. Especially, we find this during pregnancy because of the increase in the quantity of the discharge. This quite often becomes concerning to many women who are accustomed to lower volumes of vaginal discharge. Okay. All right. So let's talk a little bit about the pathological causes now of vaginal discharge. So we said that we had physiological and now we're talking about pathological. And we're saying pathological really just means that it's due to some underlying disease process. Okay. So when we talk about vaginal discharges from a pathological standpoint, I like to separate the causes into infectious and non-infectious causes. Infectious and non-infectious causes. And this is useful because what you're going to find is that the vast majority of the time, there may be an infection, but it's not always due to an infection. And this is so important. And we'll get to why it's important in a bit. Okay? Because quite often you will find that patients may go to see a physician and they will give a history of a vaginal discharge and they are treated with antibiotics without being examined, treated with empiric antibiotics or antifungals or for an infection. Having not been examined, it's possible to miss very serious pathologies like cancer. All right. So it's very, very important that if you are someone has an abnormal vaginal discharge and you're going to see the doctor, that you're examined and it's not just a situation where you're being treated, especially if having tried empiric treatment, you're not getting better. It's very important. All right. So let's start with the infectious causes because those, as I said, would be probably the more common causes. And obviously, there are many different infections that can lead to vaginal discharge, but we're going to deal with the more common ones. So perhaps the most common reason is bacterial vaginosis. And bacterial vaginosis is essentially where there's an overgrowth of some of the bacteria that are usually present in and around the genital tract, but are present in small quantities. So, of course, you know that there are different types of germs, right? You have bacteria, you have fungi, you have viruses, are the three main categories of germs. And in the case of bacterial vaginosis, it's a little tricky because it's perhaps not an infection per se, because the organisms there are organisms that typically may be found quite often in the genital tract. Issue now is the quantity. When these organisms begin to grow in higher quantities, then what can happen is that they can cause symptoms such as a vaginal discharge. And that's what essentially happens in the case of bacterial vaginosis. Okay. So, bacterial vaginosis is an overgrowth. And usually that happens because there's a change in the conditions that makes the vaginal conditions more favorable for these bacteria. And usually that's because the pH balance is thrown off. The pH balances can be thrown off for different reasons. One, if it's, for example, a certain time of the month, a woman will notice a higher rate of bacterial vaginosis in and around the time of their period because of the menstrual flow leading to a dilutional effect of the pH as well as other hormonal changes. And that predisposes them to bacterial vaginosis, which is the overgrowth of bacteria that are usually present in and around the genital tract. And we also see this quite commonly in the context of pregnancy as well, because perhaps once again of changes in the pH, and also for other reasons in women in the postmenopausal period, because the lower estrogen levels affects the pH balance as well. Sometimes there are factors that the patient that may be happening, practices from the standpoint of the woman that can actually predispose to bacterial vaginosis. So, for example, using douches, using inserts, certain herbal inserts in the vagina. One of the things that has become very popular has been placing herbal pessaries. Different brands have been promoted to improve vaginal freshness. And while that may help in the initial stages, the presence of those foreign bodies may actually lead to overgrowth of bacteria and lead to vaginosis. All right. So typically with vaginosis, what are we really seeing? Usually the symptoms would include an increased vaginal discharge. The key thing usually is that the vaginal discharge has a foul smell. It usually is described as being a fishy odor. And on examination, the color might be a little bit different. So it's not typically the white or clear. It may have a grayish tinge to it. And the woman may also note that in some cases there may be some inflammation, but vaginosis doesn't typically cause a very florid inflammatory response. Usually, if there's a lot of that, a lot of burning, itching, etc., we should be thinking about possibly something else. All right, so that's vaginosis. In a nutshell, maybe one of these days we can actually talk specifically about that condition. Perhaps the next most common reason is another of an infectious cause of a vaginal discharge is a yeast infection, or what we call candida. Candida. And, a yeast infection, as I mentioned, the different types of germs, we mentioned bacteria, fungi, viruses being the main three categories. So yeast or candida is a form of fungus, okay? And typically, these are organisms that may be present, similar to those that cause vaginosis. They may be present in and around the genital tract or the gut for women normally, but because they're in small quantities, they do not cause any symptoms, right? But whenever the conditions change, so for example, the pH changes, then you may have overgrowth of the yeast. And quite commonly, you may find both vaginosis and yeast occurring concomitantly, what we call a mixed vaginosis. Now, yeast tends to be a lot more stark, and women tend to present fairly earlier with yeast because of the associated symptoms. So let's talk first of all about the appearance of the discharge, and then we talk about the associated symptoms. So if you remember at the beginning, I mentioned the four things that we'll use to separate. So first is the color, second is the consistency, third is the presence of an odor, and the fourth is whether there are associated symptoms. In the case of yeast, typically it may have a white appearance or it may have a yellowish appearance, and sometimes it depends on the staining on the underwear. When looking at the discharge itself, it may appear to be white. In consistency, classically, it's thick and clumpy, oftentimes described as cottage cheese. You have these white clumps that may be visible on the outside or on the underwear. Typically, when we look inside, we'll see the clumps attached to the vaginal walls. In terms of the odor, it tends not to have a bad odor. So most times if there's a bad odor, it's probably not yeast. And if there's yeast, it's probably a mixed infection. But it may have sometimes a moldy smell. So perhaps the best description I could use, in medical school, they often describe it as having the smell of moldy bread because, of course, the main reason why bread goes bad is the overgrowth of fungus, and it has a similar smell to that. Okay, now the fourth thing is the associated symptoms, and these tend to be the main reasons why women come in for treatment. And because yeast tends to cause a very florid inflammatory response in the vulval area. And so what ends up happening is that there is marked itching and burning in and around the vagina, and sometimes to the point where there is bruising or what we call excoriation of the skin from constant itching. And that can be horrible. It can be miserable. I've had patients, come in so frustrated, feel like they're going out of their minds because the itching was so great. And that drives them. And usually once you're hearing about that itching and so forth, it really clues into the presence of candida or yeast as the source of the vaginal discharge. All right, so there are other infectious causes. Trichomonas is another common cause, and this is caused by another group of microorganisms. We call them protozoans. You don't need to worry about all this. It's not a big biology class. So you don't need to worry about all these fancy names. But trichomonas is a sexually transmitted infection. And so invariably, we're seeing that it usually indicates some kind of intimate genital contact or exchange of body fluids. And similar to bacterial vaginosis, causes a foul smelling discharge. Usually does have a greenish tinge to the color and has that same fishy odor. Sometimes it's associated with burning and itching, though may not be as florid as in the case of yeast. All right. And then we have other infections such as chlamydia, gonorrhea, which may also present with a vaginal discharge. These are particularly troublesome because they don't always manifest with a vaginal discharge, and many times women can go undiagnosed for some time. All right. So there are a whole host. I mean, I can't obviously go through all the causes, but these are some of the more common infectious causes of a vaginal discharge. Now, I want to spend a little bit of time before we wrap things up in this video to talk about the non-infectious causes of a vaginal discharge. And when we talk about non-infectious causes, usually these are factors that are inciting inflammation within the vagina. And these can vary from conditions such as autoimmune conditions that are causing inflammation within the vaginal area to foreign bodies that are placed into the vagina, to the presence of growth like polyps or even cancers of the cervix, right? So generally speaking, whenever there's a foreign body placed within the vagina, that incites inflammation, especially if it is there for some time. So even something like a tampon in the vaginal area can lead to inflammation, discharge. Sometimes women may use objects to clean, so inserting cleaning rags or towels or into the vagina for purposes of cleaning fragments of toilet paper. And then, of course, using douches or pessaries that women may choose to use for the purposes of freshening or keeping the vagina clean. And there's recently there's this big trend towards use of herbal pessaries for that purpose, which then causes the problem because it incites inflammation. Less commonly, and perhaps even more importantly, though, are growths or tumors, right? When I say growths, I'm trying to simplify the language as much as possible for your understanding, because we have different things that can grow on the cervix and the vagina. So, for example, polyps, which are just fleshy outgrowths from the cervix or from the inside of the womb, can actually come down into the cervix, into the vagina, and incite inflammation and cause sometimes even large fibroids that are projecting into the lining of the womb, into the inner cavity of the uterus or the womb, can cause discharges as well. And then, of course, you have cancers, most commonly like cancers of the cervix, that can cause persistent vaginal discharges. And I have seen patients who have gone to see who have had persistent discharges, have gone for treatment, gotten treatment, and the discharge is just not getting better. And when they show up on examination, there is pretty advanced cancer there. So it's very important. Vaginal discharge is something that is worth talking about, is worth understanding about. And I hope that this information has been useful to you. So let's wrap this up. In summary, we understand that a vaginal discharge is just a flow of fluid from the vagina. We understand that could be a sign of an underlying pathological problem, as well as it could be a normal phenomenon. We understand that the vagina normally has a discharge, especially for women who are not yet menopausal. We spoke about the features of that discharge. We spoke about how and to differentiate between what was physiological and pathological, meaning due to some underlying disease. We spoke about the difference between the infectious causes of a vaginal discharge and the non-infectious causes. And we summed up by pointing out how important it is for a vaginal discharge to be assessed, just to ensure that we are ruling out underlying problems that could pose an issue or a threat to a woman's health and long-term well-being. thanks again for watching. This is another educational video in Women's Health Today with Dr. C. I'm Dr. Leroy Campbell, otherwise known as Dr. C, the Women's Health Doc. If you're new to this channel, be sure to smash that like button, share, and subscribe so that we can together continue to help those women who we love. All right, bye until next time. Stay happy, stay healthy.